My name is Jill Berry Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing hot healthcare topics. Our goal is to provide you with some great education on available services and help you become a more informed consumer of healthcare. Today, we welcome Dr. Greg Brophey, a board-certified ophthalmologist who has been on NMC's medical staff since 2008. He sees patients at Northwestern Ophthalmology, and you'll find his practice located at 53 Fairfax Road in St. Albans. He's also the Executive Medical Director of Physician Services of Northwestern Medical Center. So today we're going to be discussing the types of things you might want to see an ophthalmologist for, and what to expect if you're facing cataract surgery. So, Dr. Brophey, thank you for spending some time with us today to clarify some questions and hopefully provide some great information for our viewers.
Thanks, Jill. It's great to be here.
Yeah. So I think, the first question I just want to throw out there is, because I get questions about it. So what's the difference between optometry and ophthalmology?
That's a great question. A lot of times patients ask me the same thing and they're confused about the difference. Ophthalmologists are the only IMDs that take care of patients' eye care. Ophthalmologist training is different than it is for an optometrist. Okay. So an ophthalmologist does a 4-year college degree and then does 8 years of additional training after that. Beyond that, some ophthalmologists subspecialize and do an additional 1 or 2 years subspecialty training in specific areas of ophthalmology, and that allows them to take care of especially difficult or unique cases. But an ophthalmologist is able to take care of a wide range of eye medical conditions, including surgery. So they're the only eye care doctors that really do surgery, and that's the key difference. Some ophthalmologists are also involved in medical research and are involved in an academic setting in medical research and in teaching and in patient care. So ophthalmologists take care of a wide array of patients, a lot of whom have chronic medical conditions such as diabetes, and in addition to doing surgery, also dispense and can prescribe contact lenses and glasses.
Okay, great. So I think today I'll talk a little bit about cataract surgery. And so when do you know that you might need to have cataract surgery? So what's the patient presentation for that?
It can vary. Usually patients will be aware that they have cataract if they've been told that in a prior eye exam. A lot of patients that have not had regular follow-up care will come in and just simply complain of blurry vision.
Okay.
So that's probably the #1 complaint. Oftentimes we'll get complaints that patients are having increased need for bright light when they're reading. Okay. Sometimes they'll have difficulty with driving at nighttime and they'll get glare and halos around bright lights, so oncoming headlights. And a lot of patients will simply just not be able to do the activities that they normally like to do. Some people like to knit or read for long periods of time, and that gets very cumbersome for patients. Some people will stop driving at night. So once the activity level starts to get impaired, usually patients will seek out my care for an evaluation. It's important to note that not all blurry vision is due to cataract, because certainly all parts of the eye have to be functioning normally in order for a patient to see. So, for instance, if a patient is a diabetic and they have blurred vision, they may have cataract, but they may also have diabetic retinopathy. So then it's at the discretion of the ophthalmologist as to how much cataract surgery will really help a patient. So I explain to patients, if you have multiple problems with your eyes, then cataract surgery may not be helpful. So not all blurred vision is due to cataract. But I would say that the #1 reason patients seek out the surgery is because they just simply are not seeing well and it's impacting their daily life.
So you may actually have a cataract, but you may not be ready for surgery. Is there a progression of cataracts?
There is, and there's no specific time that this progression can occur. For instance, the youngest patient I've ever done cataract surgery on was a 4-year-old little boy who was born with cataract.
Really?
Yeah. And when you're born with cataract, that's a totally different management. That needs to be taken out more emergently than it does in an adult. But for the most part, patients come in for an eye exam, and if I see cataract present, I'll just educate the patient that they've got cataract, and that can simply be observed. So I see many patients on a year-to-year basis, and we just document their visual acuity, we document color vision, other things that can be affected by cataract. And when it's time for surgery, I usually let the patient make that decision. So if a patient comes to me and they're, as I said, having problems reading medicine bottles or having trouble with their other activities of daily living, then it's time. So it really is a team effort. The patient and the physician both decide when it's appropriate to have cataract surgery. And that being said, we don't want to just do cataract surgery on someone who's looking to improve their golf game either. Some people are interested in getting rid of
I thought that might be my problem.
Well, we'll check that out later at your appointment. But honestly, a lot of people understand that when they have cataract surgery, they can get rid of their glasses because we incorporate their glasses prescription into their new lens implant after cataract surgery.
Oh, wow. That's
So
really cool.
many people seek it out and are interested in it before it's really time. And so we, of course, discourage that practice.
Sure, sure. So when someone's ready, how do you prep them, and what does cataract surgery mean for the patient?
Fortunately, these days, with all the advents in cataract surgery, it's very, very quick and simple for the patient. Usually I'll do a full exam on the patient, and we'll rule out other eye conditions, as I had mentioned before.
Sure.
Make sure there's no problems with the macula, with the cornea, anything that could potentially impact the patient's healing process. At that point, we'll have a discussion about the risks and benefits of cataract surgery. And I usually tell patients that the risk of not having surgery is far greater than the risk of having surgery. And there's almost a 100% guarantee if somebody is having vision loss from their cataracts that they will continue on that course over time, because cataract is something that gets worse, not better over time.
Okay.
So after that discussion occurs, I have a brief educational session with the patient about what to expect during surgery. So cataract surgery is typically outpatient, and these procedures are not performed they're performed in the hospital, but the patient's able to go home the same day. So after a very brief recovery time, the patient can get back home and get back to their activities of daily living, with the exception of usually bending and lifting heavy objects. So once patients hear that, they're usually pretty excited about having their surgery.
Great. Now let's get technical. So what are you doing in the OR? And
Well,
are patients awake, by the way?
Usually they are,
Okay.
although some patients, depending on their comfort level with the procedure, if they're very nervous, sometimes additional anesthetic can be given through their IV.
Okay.
So initially when patients are seen, an IV is placed in the preoperative holding area, and in that IV is given some IV anesthetic for the patient when they're in surgery. And the way I do surgery, I typically just rely on this IV anesthetic. I do not give additional injections around the eye, typically because that can bruise the eye, it can cause double vision, and it can cause other unfavorable outcomes. So usually I will put a lidocaine gel on the surface of the eye, which really does a very nice job of making the patient comfortable.
Right.
So the patient is brought back into the operating room, and a lot of patients ask, how do I keep my eye open during surgery? We have a lid speculum that keeps the eye open comfortably for the patient. And the surgery is done with the patient lying down, face up, and I sit right at the patient's head and look through an operating microscope to do the procedure. So I typically make a very small incision. The main surgical incision for cataract surgery is only 2.4 millimeters wide, which is amazing when you consider that the cataract is much, much larger than that. So I will go in and manually disassemble the cataract into small pieces and remove those through that very, very small incision. After the cataract's removed, of course, if we were just to remove the cataract and not put in a lens implant, the patient would need very, very thick eyeglasses after surgery. So we put in a lens implant, again through that very small incision, and the lens implant is rolled up like a tiny cigar. Once that gets inside the eye, it unfolds kind of like a flower opening, and that allows us to insert a lens implant that's much, much larger, sometimes with a diameter of 14 millimeters, through a 2.4 millimeter incision. And so the small incision size really, really helps patients see better very, very quickly after cataract surgery. So many patients that come in to see me at day one post-op can see 20/20 or 20/25 without glasses, which is really a nice thing. Not the case with everybody. Some patients come in and are very blurry the one day after cataract surgery, but I just try to encourage patients that all surgeries are different, and usually within several weeks after cataract surgeries, patients can see a big difference with regard to their vision.
Wow. Now, you describe it, all these steps. How long is the surgery?
The surgery can take as quick as usually 8 or 9 minutes, and sometimes it can take twice that long. It just depends on the patient and depends on the surgery. Usually patients are amazed when it's over, and I tell them they're done, and they're like, I didn't even feel anything. I didn't realize you had even started. So that's always nice to surprise the patients that way.
So you have one cataract. What about the other eye? Do you find the other eye following? And then if they have two cataracts, you do the surgery all at once, or?
Great question, and this is one that I typically get asked by patients. First of all, just because a patient has a cataract in one eye does not mean that they're going to have cataract in the other. So sometimes we'll do cataract surgery on the first eye and not do the other eye for years to come. If a patient does present and has cataracts in both eyes, we never do them at the same time. So I usually ask the patient which eye they want to do first. Usually it's the worst seeing of the two, and if they see approximately the same in each eye, then we just arbitrarily pick one. But the surgeries are generally separated by a week or two, depending on how the first eye goes. So at the time the patient comes into my office, if they've got cataracts in both eyes and they want to have both done, what we can do is we can schedule the first eye and plan a tentative date for the second eye a week or two later.
Great. So is there any precautions after surgery? You've mentioned a couple, but just it sounds like they get their eyesight back pretty quickly, pretty clearly.
By and large, they do. By and large, they do. The biggest thing I tell patients is to let me know if they have any signs of infection. Infections are extremely rare after cataract surgery. It's much, much less than 1 in 100 cases. It's probably along the lines of 1 or 2 per 1,000 patients. And it's been years since I've even seen a patient that's had an infection after cataract surgery. But we typically advise patients to let us know if they have anything like pain, redness, light sensitivity, or a decrease in their vision. Any of those things are somewhat suggestive but not diagnostic of an infection. So I typically will counsel the patient on warning signs, things to look for after cataract surgery. And typically we advise patients to get back, and we encourage patients to get back to their usual activities as soon as they would like after cataract surgery, with the exception of bending and lifting. So a lot of my patients that are farmers or who work in a daycare, I advise them to really be careful bending and lifting, because that can cause fluid to leak out of their incision.
Great. You seem so passionate about it, and I know you are, having worked with you. So what keeps you so excited about this profession?
Well, it's interesting that you say that. I was speaking with someone this morning about that, and I really think giving patients their vision back is a lot of fun. And seeing the look of surprise on their face about how much patients didn't realize how much vision they had truly lost really fuels me and prompts me to continue offering that same level of high quality care. So I just can't imagine doing anything else in life, and I typically tell patients, sometimes when I'm in surgery, I don't even believe that I get paid for being there. It's so much fun. So it's really a lot of fun, and I'm very fortunate to be involved in the care of patients' eyes.
That's great. Well, it absolutely shows, and I know your patients just absolutely love you.
Thank you
for that.
It's great to hear.
So as we begin to wrap up, there's a question. If you said you had mentioned you work with farmers, and there's people, we have a lot of different industries around here. What if someone gets something in their eye? I mean, I think that's something off the cataract topic, but I think interesting, because people might rub their eye or try to flush their eye. What should you do if you get something in your eye that may even become a puncture? That's
a great question. You know, we see this all the time, and a lot of times patients will be wearing eye protection, and a lot of times if a little foreign body like a piece of rust or dirt is in the hair and the patient removes their safety glasses, that can get inside the eye. So I would encourage everyone, when they're working in a high-risk field like auto mechanics, or even in a farm where the potential for foreign bodies could exist, it's very important to wear a pair of safety glasses. But if that occurs, it's very important to try not to rub the eye, because sometimes more damage can be done by scraping the lid with the foreign body over the cornea. I think it's a great idea for the patient to present to either an ophthalmologist like myself, or to even go into the emergency room or an urgent care. Those centers are usually very good at diagnosing foreign bodies in the cornea. And a lot of times, if that can't be handled in that setting, they will contact me and send the patient to me for care.
Great. Well, Dr. Brophey, it's been fun talking with you today. So thank you so much for joining us and giving some really great information regarding eye care.
It's been a pleasure. Thank you.
Thanks. So I'm Jill Berry Bowen, CEO of Northwestern Medical Center. Thank you so much for joining NMC Healthbeat. And please take care of your eyes.